the better, the earlier we start, the better. So hello, everyone. It is so nice again to see you all online. I think this is the last one, the last series, the last webinar of the series of what we call Spring program before we go into summer break. So during July, there won't be any webinar, and then we will meet again in August. But I will be sharing the new program soon, the next week latest. Yes. So yeah, today some of your colleagues will be sharing the projects they implemented with the UATC rehabilitation grants. Elçin, the project associate, will tell you more about it. And yeah, we'll be framing a bit the rationale of this UATC and these rehabilitation grants. But before that, I want to, as always, remind you of a bit the house rules that I'm sure you're all familiar with by now. But as always, remember that we have simultaneous interpretation available from English to French and Spanish. So make sure you're on the right channel under the interpretation icon. It's a glove icon. Um, and yeah, before we delve into the discussion, I'd like to start by giving the floor to Lisa Henry, IRCT Secretary General, to set the stage a bit with her welcoming remarks. So Lisa, you can go ahead.
Thank you very much, Berta. It's really nice to see you all. And this time, from sitting here in the Secretariat in Copenhagen, I bring you greetings from all the IRCT ExCom members who, for your information, just met in Tbilisi, Georgia, to work together with the Georgian Center for Rehabilitation of Torture Survivors, to interact with the European Union representative there, and to interact with the Danish representation there, and not least other civil society actors on the ground in Georgia. As you would know, these very days, the Georgian population, many of them have a very precarious situation. There has been protests in the late November, December. There are many of the survivors from the protest who've suffered police violence. There's been a preliminary report on torture that has occurred during those protests. And civil society there is very anxious these days. And there are subsequently many people actually in detention at this time. So it's interesting, and I say that and bring those greetings to you to bring the reality of our very precarious situation these days with torture survivors to your attention. And also to remind, and that was the conversation we had with the European Union there, about the importance of civil society and the importance of actors like you being able to actually respond. And the rep at the EU office, they're very impressed by these very small, relatively small grants, 10 to 30,000 euro, a little bit more, the creativity and the ability of civil society to do incredibly impactful things with small funds like that. Small, we talk about, it's super relevant funds. And I'm really happy to be able to say that there was a huge appreciation from these two representations about the need for psychosocial support, the need for care for caregivers, and the need for these really creative civil society organizations like yourselves working on the ground, behind the scenes, pushing decision makers, but providing for rehabilitation support. So I just wanted to bring that to your attention. In addition, the creativity of a small group of survivors from Colombia who represent a global problem, ocular injuries. These young survivors treated through a rehabilitation center in Colombia, CAPS Colombia, were able to work through their injuries, get an understanding of what has happened to them, come together as survivors, form a group that's now pressurizing the government and changing some policy there. And I think all these different pieces of the work that we saw illustrated in their dance and performance number at a big festival for looking toward the future in Georgia represent what you're all about. So I think it was just interesting to think the work that you do and the results that you're now portraying, and you'll hear from good colleagues today on best practice. What can these creative looks at way we do rehabilitation in different contexts, in different geopolitical contexts, cultural contexts, and against a huge funding cut from the US government? What can we do anyhow? Why is there hope? Why do we continue this work we do? So with those opening words, I say I really look forward to hearing how centers are coping, the activities and the results you're achieving, your creativity and your solidarity in this space. So welcome again to the IRCT. This is the last of this first half of the year webinar series, and great to see so many familiar faces, but also new faces. Thanks very much.
Thank you, Lisa. Yes, and with those great words that I think are good to keep in mind before we enter the summer, to come back with more energy. But yeah, I would like to introduce the four panelists today who have kindly prioritized their time to present. And these are Elçin Türkdoğan. I hope I'm pronouncing it correct. She's the sub-grants officer at the IRCT, and she has also been leading the work that the IRCT is doing under the UATC, the United Against Torture Consortium. She will tell you more about it in a bit. Then we have Bojana Trivuncic or Trivuncic from Jiyan, Serbia. Then we also have Mike and Eugenia Mpande from Tree of Life, Zimbabwe. Pitambar Koirala from TPO, Nepal. And Chenar Ahmed from Jiyan Foundation in northern Iraq. So the way we will do this is that each of them will get 10 to 15 minutes to present the projects. And they will be followed by some questions. So please, I kindly ask you to listen in and make sure that you keep your questions for the Q&A space at the end. So yeah, and with that, Elçin will start with giving us, I can see she already has the presentation set up. We can all see the screen. So Elçin will start telling us a bit more about the United Against Torture Consortium and these rehabilitation grants.
Perfect. Oh, okay. Thank you. Thank you, Barta. And my name is Elçin, as Barta mentioned. I am working as sub-grant coordinator at IRCT for 2 years, but before that, I was working at the Human Rights Foundation of Turkey for 13 years. I can say that I have been involved in this field for many years, and I am very happy to be with you as being part of IRC Secretariat for 2 years. And before, welcome and thank you for participating to this seminar. I hope it will be helpful and useful for you. And today, we are, as Bart already mentioned, today we are here to share the outcomes of IRCT Rehabilitation Grant Program, which was launched in 2024. And as you know, for IRCT member organization that receive this support will present their achievement, their activities, as well as the challenges they faced within their specific country context. But before we hear from them, I would like to start by providing a broader overview of the results and overall impact of this support program. First, I would like to note that this program is a part of the United Against Torture project, which is an effort and project led by UATC Consortium, and this consortium consists of 5 international organizations besides IRCT. And it was supported by European Union, and this still continue until the end of next year, June. And the aim of this rehabilitation program was to support civil society organization, primarily IRCT members organization, in sustaining and strengthening their rehabilitation services for survivors of torture. And this should be done by promoting the use of IRCT global standards on rehabilitation. And the core objective was to ensure that survivors and their relatives receive holistic, survivor-centered, appropriate, and accessible rehabilitation services. And through this program, IRCT has provided financial support to 17 civil society organizations, 15 are member, 2 were non-member organizations, and across 15 countries. And they are, I know some of these organizations are with us today. I just want to mention their name. International Aid Network from Serbia, Restart Center from Lebanon, Center for the Study of Violence and Reconciliation in South Africa, Center for Victims of Torture Kenya, Vishan Organization in Iraq, Legend Golden Care Foundation in Nigeria, International Medical Rehabilitation Center in Ukraine, Jan Nitra People Committee on Human Rights in India, Transcultural Psychosocial Organization from Nepal, Jiyan Foundation for Human Rights in Iraq, AGPMV from Chad, Independent Medical Legal Unit from Kenya, the Albanian Rehabilitation Center from Albania, SAPGL from Burundi, Zimbabwe Association of Doctors for Human Rights from Zimbabwe, Tree of Life Trust from Zimbabwe, and lastly, Sintras from Chile. These are the 17 organizations. In total, over 500,000 euro was allocated among these 17 organizations, with each organization receiving up to 31,000 euro. And with this support, organization, sustain their rehabilitation work, continue to work at the forefront of preventing torture and ill treatment, but mainly providing essential care and support to survivors. With contribution of this support, a total of 4,783 survivors and their relatives across 15 countries have so far received rehabilitation services. I need to say that there are still projects continue. And these rehabilitation services mostly included medical and psychiatric care, physiotherapy, psychosocial support, including psychodynamic, cognitive, behavioral testimonial therapies, medication, medical examination, surgical intervention, legal aid, counseling, training session, community outreach program, peer support, and livelihood assistance. And the diverse set of services was tailored to the individual needs of survivor in the specific countries and their family members, their relatives, ensuring a holistic approach to rehabilitation. And the rehabilitation services reach a wide range of survivors all over these countries. And they include political opponents, ethnic groups in Burundi, migrants, asylum seekers, including separated children in Serbia, Yazidi women raped and enslaved in Iraq, Sudanese refugees, peaceful social environmental protesters in Chad, relatives of forced disappearances, extrajudicial killing victims, young protesters in Kenya, refugees, protesters in Albania, opponents of the ruling party, and Tutsi ethnic groups members in Burundi, human rights defenders tortured during the protests in Zimbabwe. Again, in Zimbabwe, children of survivors of organized violence and torture, survivor of dictatorship area torture, students, activists, and human rights defenders in Chile, refugees, detainees imprisoned for political or judicial reasons in Lebanon, refugees, human rights defenders, victims of state oppression, police brutality in South Africa, asylum seekers from South Sudan in Kenya, adult male prisoners in northern Iraq, women, girls, children, and inmates subject to torture in Nigeria, internally displaced persons, war victims, residents of occupied territories in Ukraine, marginalized communities, and survivors of caste-based discrimination and extrajudicial killing in India. And beyond the direct rehabilitation services, support activities, and the program also invested heavily in building capacity of professionals and stakeholders involved in this field, in the field of prevention of torture. Nearly 1,000 rehabilitation providers and relevant professionals, including law enforcement forces, lawyers, journalists, human rights defenders, health professionals, community leaders, benefited from the capacity building activities. Example includes supervision sessions and individual support for staff and volunteers in Serbia, medical legal documentation training based on Istanbul Protocol in Lebanon, trauma phase workshop in Kenya, training on physical and psychosocial impact of torture in India, trauma-informed care seminar for professionals from NGOs, civil society organizations, schools, and public institutions in Iraq. Sorry. Training for law enforcement officials in Nigeria, workshop on trauma-informed care and care for caregivers in Nepal, again care for caregivers session for rehabilitation providers in Kenya, and communication and prisoners' rights training for prison guards in Iraq. These are the activities besides the rehabilitation activities. I mean, the example of them, of course, there are many. And lastly, I would like to mention the overall impact on the lives of survivors. And these rehabilitation and capacity building activities have translated into measurable improvements for survivors. I can share some key results from different countries. As you can see, 251 survivors improved emotional stability in Serbia. In Lebanon, more than 100 survivors reported a stress reduction, with almost 90% improving in at least one symptom area. In South Africa, 154 survivors gained mental health and community resilience. More than 200 survivors achieved psychosocial and behavioral improvements in Kenya. In northern Iraq, 41 survivors reduced trauma symptom by almost 50%. 224 prisoners received mental health education. In Nigeria, almost 900 survivors, primarily in custody and IDP camps, improved well-being and legal support, secured the release of some of the detainees, and increased legal awareness for 390 survivors in Nigeria. In Ukraine, almost 300 survivors improved their physical and mental health through mainly mobile outreach. In India, 696 survivors enhanced mental health through testimonial therapy and legal aid, livelihood initiative, peer support, and 9 survivors secured compensation. In Nepal, 214 survivors improved psychosocial well-being through counseling, livelihood, psychiatric care, health services. More than 500 community members built resilience via support activities. And in Iraq, 79 Yazidi survivors stabilized trauma symptoms and improved reintegration prospects. In Chad, almost 400 survivors strengthening emotional stability. In Albania, 300 survivors reduced trauma symptoms and some of them gained legal empowerment. In Burundi, more than 200 victims improved health and emotional resilience. In Zimbabwe, 100 human rights defenders enhance physical recovery and resilience, and they can continue their human rights activities. 90 children processed trauma and improved emotional well-being through the workshops. And lastly, in Chile, 141 survivors reduced trauma symptoms, improved autonomy, and advanced legal process for justice. This is all the results IRCT member organization achieved during the rehabilitation program. And as Lisa mentioned, it was very limited contribution, but what they have done is really great. It was really great, I can say. And I just want to say to conclude, through this very limited IRCT rehabilitation support program, the members have made a meaningful contribution to the lives of thousands of torture survivors, their families, across diverse and challenging contexts. We need to highlight it. In the challenging context, all these activities are done and were done and the results were achieved. And I know that while the numbers are important, but we all know that what really matters are the individual journey of the recovery, resilience, and justice that lie behind them. And I think that's why, yeah, my part is over. And thank you for listening. But I think the presentation by our member organization, which received this grants, will provide us with a deeper understanding of the impact of the rehabilitation support in their country. Thank you for listening.
Thank you, Elçin. And yeah, as you say, what the real impact is on the individual lives of each one of these single survivors. But yeah, thank you, Elçin. It was a very good overview and understanding of these rehabilitation grants. Agnes, I see you have a hand up, but the way we're gonna do it today is we're gonna take the presentations, the 4 presentations now from each one of the member centers who implemented projects under these grants, and then we will take the questions at the end. So make sure you stay here until the end. And the first one presenting is going to be Bojana Trivuncic from Ian, Serbia. So Bojana, the floor is yours. If you want to share screen, you can also do that yourself.
Okay.
There you go.
So can you see it, my presentation?
Yes, I think if you try to put it on bigger screen, so full screen.
Yes, I'm trying. Just a
You
sec.
should, if
Is
you
this
go.
better?
Yes,
Okay.
perfect. Perfect.
Okay. Hello, everyone. My name is Bojana Trivuncic. I'm working in Jiyan International Aid Network in Belgrade in Serbia for more than 25 years now. And I'm very happy to be here. It's very nice to see you all. And it's really impressive, Elçin, you know, what we have done, you know, or what you've done with this grant all over the world. It's very impressive how many people received some kind of assistance. And I'm very happy and proud to be part of that and my organization. So in this presentation, I will first just shortly say something about my organization for those who don't know anything about Jiyan. Then I will share a little bit, just tell you about context. I mean, what is the situation now in Serbia? And then I will share the main results from this project that was funded under the IRCT grant. So Jiyan was founded in 1997, very soon after the war was over. After the war was over in just a second. In the former Yugoslavia, as you know, the war was here from 1991 to 1995 in Croatia and in Bosnia and later in Kosovo. And very soon after the war was finished, we established with Jiyan in Belgrade as a non-governmental organization with the aim to provide assistance to survivors of war trauma and refugees and IDPs that fled from Croatia and Bosnia, fled from war. And in Serbia in these 90s, more than around 500,000 refugees came to Serbia at that moment. Later in 2000, we established within Jiyan Center for Rehabilitation of Torture Victims, and with a special focus on torture victims among refugees and IDPs. And then we started to provide comprehensive rehabilitation services to victims of torture that included psychological assistance, psychiatric, psychotherapy, medical, including medicines, legal assistance, livelihoods, vocational trainings. We are trying since then to establish, to have all these services. We are now providing also comprehensive rehabilitation services, except legal assistance. We refer our clients to other NGOs that provide this type of assistance. We also have department for advocacy activities. We were very active in advocacy for the criminalization of the act of torture in 2005. And we have strong advocacy activities for the right to rehabilitation in front of UNCAT and other national institutions. We also have done many researches, and we were very active in this research field, in the field of psychological trauma and consequences of torture and war trauma. During this more than, it's now 28 years, we provided rehabilitation services to more than 15,000 torture victims and family members. And our beneficiaries were not just torture victims and trauma survivors in the war, but also all other marginalized people that are under risk to be tortured, like Roma population, people living with HIV, drug users, psychiatric patients, etc. Now, I just wanted to share a little bit about the situation right now in Serbia. Actually, Serbia is facing a political crisis in the last couple of months, several months. 7 months ago, a part of the rail station building collapsed and killed 16 people, and no one held accountable for that tragedy. And since then, we have massive students and citizens protest against the government in all cities in Serbia. And the main demand is for new elections. And actually, in the last couple of years, there's been a backsliding in terms of human rights in Serbia. And many activists, independent journalists, and many people that are fighting for democracy experience actually in Serbia different forms of violence, campaigns against them that are led by regime supporters, etc. So all this create, so many, I mean, the number of people that are seeking assistance from us is increasing lately. And now a little bit about main results that main result from this project that was financed by IRCT. The project lasted for 1 year, from February 1st, 2024 until the end of January this year. The grant amount was around 31,000 euros. The target groups, the activities were for groups, victims of torture from the war in former Yugoslavia that are living now in Serbia, but also in Bosnia and Herzegovina. And these victims are also witnesses in war crime trials. So they were also our beneficiaries within this project. The second target group is activists and journalists defending human rights from local population in Serbia, who were subjected to numerous verbal threats and violence that was instructed by the authorities. And some of them were even exposed to physical violence by the police. And the third group, target group, is torture victims among refugees, asylum seekers, and migrants that are coming to Serbia from Middle East countries, North Africa, Ukraine, and other countries. A special focus within this project was given to unaccompanied minors, separated children among refugees and asylum seekers. 59 of children, we provided some kind of assistance to 59 children. And at the end of project, total number of 329 torture victims and family members were reached and directly benefit from comprehensive rehabilitation services. 264 were victims of torture and 65 were family members. And we provided 1,379 interventions. So project activities took place in Serbia and in Bosnia and Herzegovina. In Serbia, IAM provided services to beneficiaries that are settled in some of asylum centers or reception centers in different cities. Some beneficiaries were settled in the Center for Accommodation of Children that are traveling alone without parents. Also, some of our beneficiaries are in shelter houses, in private accommodation, and etc. And we provided assistance within our office, but also through mobile team visits to these refugee centers and also in Bosnia and Herzegovina to ex-detainees and victims that are witnesses in the courts war crime trials. So main project activities within this project were psychological support that was organized through individual and group support. And psychological support, we are in a way adjusting this psychological support to beneficiaries because we have different type of beneficiaries. So we provide psychological first aid, psychotherapy, psychological preparation for the witnessing in war crime trials, psychological preparation for the asylum interviews. We write psychological reports and psychiatric reports in support to asylum claims. We are doing, we did the documentation according to Istanbul Protocol. So this, we separated this, different, in a way, different type of psychological support because, for example, we provide psychological first aid for young male migrants that are coming to Serbia and they are not staying for a long period of time here. So we adjusted support to their needs. So we are doing providing group sessions for them because we see them, for example, only once or 2 or 3 times, not more, because they're staying very short time here. So we are providing these group support sessions where we provide psychological first aid, information assistance, and in a way psychoeducation, trauma-informed knowledge, so they can, in a way, when they reach some European Union countries, they can reach for help if they feel something that can be related, some consequences that can be related to their trauma experience, because they face violence against on border during their journey to some of these EU countries. Psychotherapy we provide within our office and to refugees, asylum seekers that are staying for a longer period of time in Serbia. And also in Bosnia, we provided psychological preparation for the witnessing in the war crime trials. Within this project, we provided also 26 psychiatric interventions, 135 medical interventions, and we also provided psychosocial support that was done by our volunteers. We are collaborating with the Faculty for Social Work in Belgrade and Faculty for Psychology. So their students are volunteering here in our organization, and they usually, after the training here, they provide psychosocial support to our beneficiaries. It's assistance in every day life. They are helping our beneficiaries to communicate with public institutions like medical institutions, to search accommodation, to search for employment opportunities. They provide also different workshops to our beneficiaries. They do some kind of, provide we are organizing visits to museums and historical parts of the city, so they can get to know the city and to how to move in the city, to use public transportation, etc. And they also practice in that way Serbian language. We also had within this project, we had public awareness activities. We commemorated different important UN days like 26th of June, but also 16 days of activism or other international human rights day, and etc. And we provided, we commemorated these important days through different workshop activities with our beneficiaries. And we also in this we organized systematic medical examinations for the women, 14 victims of torture, as a part of this initiative to mark significant days during October, November, and December. Also very important activity within our project was supervision for the staff or care for caregivers sessions that we provided to our volunteers and also to staff that are providing rehabilitation services. So what were the main challenges? One of the big challenge in our work is actually, as I mentioned, because is the refugees, asylum seeker, and migrants that are coming to Serbia from Middle East countries and African countries. They usually don't want to stay in Serbia, and actually they are majority of them, they are in transit. Although some of them are staying here just for a couple of days, some of them staying for a couple of months or couple of years, but majority of them leave Serbia. So that is a great challenge when we speak about rehabilitation process, because sometimes they just leave in the middle of the treatment and go on the game, so that they could continue their journey. So it's a great challenge for someone who is providing rehabilitation to victims. The second challenge, I was just, when I was preparing this presentation, I was thinking about these challenges, and the main challenge also is when we speak about psychological preparation for the witnessing in these war crime trials. It's also a great challenge for the psychotherapist, because within this process we're trying to motivate our victims to be a witness in these processes and to take part in that, because it is very important for transitional justice in this region, but also it's very important for victims' own recovery. But in reality, the process is completely different from what we and our beneficiaries expect, because usually they often are re-traumatized. They usually go by themselves in this court. They're alone. They don't have no one to accompany them, so they usually feel like they are committed a crime, not that they are victims. And perpetrators very often are sentenced with inadequate sentences, and they're sometimes, and many of them are released altogether. So it's very challenging to provide and to motivate people to be a witness, and at the same time to know that that this experience is not going to be very good for them. But anyway, I think that we should be proud on our achievements, because I think that as many of, you all, we have all similar methodology that was proven to be very effective, and we use this comprehensive approach, comprehensive rehabilitation services, individual approach, client-oriented approach, and case management approach. And we used this methodology for years that was proven to be very effective. And also beneficiaries expressed very positive impression about our services during this project, and we also received very valuable positive feedback from other organizations that are referring beneficiaries to our services. So that's it. Thank you for your attention.
Thank you so much, Bojana. It was a very good presentation and overview. And thank you also for your honesty about the challenges of testifying in war crime trials and supporting these transient populations that you were mentioning. I'm gonna give the floor straight away to our colleagues from Tree of Life, Mike and Eugenia. The floor is yours. And for the audience, please remember that to keep your questions at the end. So we're going one presentation after the other.
Thank you so much, Beta. I hope you can hear me.
Yes, we can hear you. If the only thing, if you could put the slides full screen, Eugenia.
Good.
Think.
Let me do that.
I think if you go here to this icon up top, right. If you go to presentation,
Or you can just click on F5.
F5. Thank you, Bojana. F5.
Thank you, thank you. Not responding, eh?
Not working.
No.
If you go, if you see below, like in the bottom of the screen, next to the zoom option, there's a kind of a slide on the left, a little bit to the left, to the left, to the right. So two icons to the right is this slideshow icon.
All right. Yes, that one.
This one, yes.
Thank
Exactly.
you.
Perfect.
Thank you so much, Beta. Yes, thank you, Elçin, for the overview. We are so grateful to IRCT for this project. And let me introduce myself, and then I'll ask my colleague Mike to introduce himself, and then we will continue with our presentation. I am Eugenia Mpande from Tree of Life, and I've been with Tree of Life for the past 14 years. Mike, for an introduction.
Good afternoon, good morning, depending where you are. I am Mike Ncube. I'm the programs manager at Tree of Life. I've been with the organization for the last 22 years now. Thank you.
Thank you so much. Thank you. And we are talking about an opportunity that we noted a long time ago, the need to work with children whose parents are survivors of organized violence and torture. So the project started in March 2024 to February 2025, and we received 21,000 euros. Many thanks to IRCT, EU, and United Against Torture. This grant supported us to actually strengthen the Tree of Life work, the Tree of Life framework of delivering community-based mental health and psychosocial support and rehabilitation for survivors of organized violence and torture. And this was in full alignment with the international rehabilitation standards. We were able to deepen the impact of the project by integrating Singing to the Lions, which is a resilience building program that empowers children as well as communities to confront fear, to address trauma and adversity stemming from violence, displacement, and intergenerational harm. This methodology is grounded in positive psychology of storytelling and participatory learning. It restores hope, confidence, and agency amongst children, as well as strengthening community structures for support. And in this case, including the survivors themselves, the parents, the guardians, and stakeholders. I will ask Mike to come in and talk about the operating context. Mike, over to you.
Thank you, Eugenia. This much appreciated project was implemented in a context where political landscape remained dominated by the ruling party that often suppressed dissent, creating fear among human rights organizations. Sometimes activities will be disrupted if they were deemed counter-party activity, and with economic constraints in Zimbabwe in the period under review, Zimbabwe introduced a local currency which lost its value against the US dollar after 6 months. and then forcing price hikes across the country, and people's buying power was reduced considerable. So people went to poverty, and a lot of trauma and stress affected. There is visible societal stigma, which discourages some survivors from seeking help and participation in rehabilitation programs due to the fear that people that I've alluded to, and lack of safety and security. Thank you. Over, Eugenia.
Yes, so it is within this context that we were able to implement the project. And the main goal of the project was to strengthen sustainable, holistic rehabilitation and psychosocial support services to children and families affected by organized violence and torture. And of course, we were looking at our rehabilitation standard number 4 and 7. We also had specific objectives aimed at increasing capacity within the Tree of Life team, and then also building capacity of our community facilitators to provide support and rehabilitation services to families, including children of survivors of organized violence and torture. We also really was looking at reducing levels of trauma in families or torture survivors. We had a number of activities that we implemented. So the first activity was a capacity strengthening of our Tree of Life team. We had 12 staff members, program staff members, 5 males and 7 females who went through the process. And these then were able to train the community facilitators, building capacity, and also mentoring and coaching. We had 33 community facilitators that were involved from 2 regions that were severely affected by organized violence and torture. Then we started implementing Singing to the Lions after creating a base that was strong, foundation that could actually support the Singing to the Lions intervention. We implemented this project with 4 groups that were coming from 4 communities. Identification was done using our database, looking at those communities that were severely affected by organized violence and torture. We also included parents and guardians, as well as important stakeholders in these communities. We included the Department of Social Development, the community care workers. There were also organizations that were involved, like the community-based organizations, the faith-based organizations. There were international non-governmental organizations as well within the specific communities, and other national NGOs. And this was so important because we, at the beginning, started developing referral pathways during the training so that children could actually get support that they needed. And we're also looking at sustainability because we knew the project was for 1 year, but we already have structures in the community that would then continue with this work. So a total of 90 children, 43 males and 47 females went through the Singing to the Lions workshops, which is a 3-day workshop. And like I said, that takes children through activities to actually use their own resources and also to reach out to other community members so that they can cope better within the context. And then after our implementation of the Singing to the Lions, we went on to implement the Singing to the Lions clubs within the different communities. These were so important because those who had gone through the Singing to the Lions with support from the community facilitators, with support from some of the stakeholders that I have mentioned, started action groups. to support others who have not been through the process, but also to strengthen what was learned, the knowledge and the skills amongst children, and also to establish peer support. So a number of children joined. And by the end of last year, the numbers had doubled. We actually had more than 185 children participating in these action groups. Teachers were also involved with guidance and counseling teachers involved who would actually refer children that were struggling to cope. And we also had our community facilitators. The parents and the guardians were also referring children that were struggling to the Singing to the Lions clubs. And these clubs are ongoing. They're still continuing in the communities, and more children are joining. We are looking at this as something that will continue in communities. And then we also have other projects that are within the community. So our youth groups within those communities, our youth facilitators are working closely with the community facilitators that were trained so that this process can continue. So the key achievements, there are so many, but yes, we will look at the strengthening that's happened in terms of the Tree of Life core team and the community facilitators. Yes, they've been doing a lot of work with adults and had noted the need to work with children. So they got an opportunity to get capacitated, but also to practice, to be mentored during the project period. And of course, support is continuing. We were able to integrate a holistic model that reinforces community resilience because the community members were involved and to support the children. And also this enhances recovery, ensures survivors lead the path to restoration and justice because the community facilitators are survivors. And so this also supports their healing process as they continue to do this work. It promoted sustainability. I spoke about that earlier on. Locally driven healing practices that can actually continue in communities given the funding challenges that we have at the moment. We do have that structure in the community that can be used. So the target group were children between the ages of 16, and of course, these are children who have witnessed directly or have suffered from secondary trauma because of the impact of organized violence and torture on their parents. The parents were engaged. There were also some parents available to support the activities, enhancing their capacity to provide emotional support to their children. I mean, given the shortages of expertise, so parents are actually supporting children within the community. The trauma-informed participatory methodologies through guided discussion, storytelling, and role plays, supported the children to articulate their fears and past trauma and be able to, a very large extent, face them. And this also improved their coping mechanisms as well. The activities were highly interactive. They were relatable and fostering strong engagement and trust, promoting constructive coping mechanisms or coping skills within the family setup and for the children as individuals. The activities also enabled children to process their trauma and also feel emotionally lighter and more relieved after sharing and after experiencing with support of their peers. So resilience building is a lot of resilience within the community setup and amongst the children. Empowerment and agency. This also strengthened family systems. We also received very positive feedback from the children, and we continue to receive positive feedbacks from the communities as well. This is an intervention that also improved our relationship with stakeholders and government ministries, because they've seen the need and they're seeing Tree of Life coming in to actually bridge the gap. So Mike will continue with challenges. Over to you, Mike.
Thank you, Eugenia. Yes, we have scored successes, the achievements that Eugenia was talking about, but we met some challenges with some activities which were disrupted. One was disrupted in a community called Cholocho, where we're implementing, and then a political party had its activity on short notice and then disrupted our workshop. What we did to mitigate further damage was to make sure that our community facilitators, stakeholders, and children in the workshop were safe. So we moved them. We moved to another community, and we used the same budget where implementation was successfully done. So when it got disrupted, we made sure everyone was safe. Children went home, and stakeholders addressed the situation, and we returned to our office, and then we planned for another workshop somewhere which was safer. Yes, and then we also made some challenges working with children, whom some with limited abilities of reading and writing, but we spent more time. Our community facilitators that Eugenia alluded to spent a lot of time to support the process so that the project participants understand the process, and it came out very well. We are challenged with time management, but we're up to the task. The problem that we were facing was children would walk long distances to and from the venue. They would arrive late and needed to leave early. So we're to maximize the available time for the workshop to be successful. So we give them support, quite a lot of support. Yes, we learned lessons along the way. Like Eugenia spoke, we included government stakeholders who work directly with some children, and some of them already have cases in their hands, and we make sure that we are able to support the process despite their failure to follow up on those cases. And then we help them. We help the cases to be concluded somehow through our processes. Then we have got an ongoing support, monitoring. It is important to have an ongoing support and monitoring for all identified participants who require additional assistance. And our structures in the community continue to do this. Yes, and by making home visits of these identified people and also seeking additional support have been very fruitful, and the environment is so conducive for them to do that. Since they are community rooted, community driven, they help the project to continue. There is sustainability there. And then, yes, we face challenges, we scored some successes, but we're seeing a lot of other opportunities happening during the period under review. There was more awareness on human rights issues with some within the civil society, leading to stronger advocacy efforts. We saw a lot of young people getting engaged in activism, giving fresh energy and perspective to rehabilitation initiatives, doing it in a way that is contextually appropriate, that makes sure that people are supported and they seek rehabilitation. And local communities and local leaders have been very supportive in every sense they could, in every aspect they could in their context. Thank you.
Thank you. We have a few photos to show. Children there singing to the lions. Yes, with one of the Tree of Life community facilitator. And then, yes, I'm sure you saw this photo on Elçin's presentation, and then children. You can see how much they are concentrating. They're doing a tree of life activity that is in the singing to the lions, preparing to share with their colleagues, their peers. Yes. And so, yes, lastly, this project was really successful. It was, it actually supported Tree of Life work in the community, and we can see a lot of potential for growth. There are opportunities that Mike shared. Over to you, Beta.
Thank you so much. Thank you so much, Mike and Eugenia, for this great presentation. I remember the singing to the lions modality that you explained in a past IRCT webinar. So it's good to hear that, that this methodology is expanding and that some of them are also creating action groups, as you were saying, and establishing peer-to-peer support. So yeah, thank you so much, Mike and Eugenia. We'll move straight to the next panelist, the next presenter, who is Pitambar Koirala from TPO Nepal. Pitambar, the floor is yours. Let me know if you need help. There you go. We can see the screen. Perfect. We do not hear you though. Pitambar, we don't hear you. We cannot hear you. Not sure what's happening. Hold on.
Okay.
There
This
you
is
go.
fine? This is fine?
Yes. Now we can hear you.
Yeah, sorry. Hi, everyone. This is Pitambar Koirala. I'm working in the TPO Nepal. First of all, I'd like to thank you, IRCT team, and thank you for the opportunity. And thank you all of you who joined this important webinar. Now I'm sharing experience for the sustain and strengthening holistic rehabilitation for the torture survivors projects. First, I like to share the commitment of the PSA. TPO Nepal always the commitment in preventing sexual exploitation and abuse. And there is the hotline number and even the email number. If there is an issue, everybody can share related to the PSA. So I and TPO Nepal also always commitment the PSA. And first, I'd like to introduce the TPO Nepal. TPO Nepal is NGOs established in 2005 with the aim of the providing mental health and psychosocial services. It's the different four thematic area we are working. The first is the service delivery. It is related to psychosocial care and support and mental health treatment. And the second is the capacity building. It's the different capacity initiative. It's started 3 days to 6 months. And the third thematic area, the research. TPO Nepal is conducting the different layer of the research. For example, IRCT, project evaluation, action research, assessment, like that. And the fourth thematic area, the advocacy, we always advocating the mental and the psychosocial services is the very much neglected area. So TPO Nepal is one of the thematic areas, the advocacy. And now current TPO Nepal is working the different 65 municipalities in the countries, but through this project, we are providing service in the 4 different municipalities. They are located in the western part of the countries. The project started the March 2024 and will ending that September 2025. And hoping this will be extended, and with this project objective enhance the psychosocial well-being, resiliency, and community reintegration of the survivors. Just we celebrate the TPO days or TPO established days in this section. So I would like to share its achievement with one slide. Till date, we reached the 1,033,973 people through the different services or research like that. And in the services, it's the mental health and psychosocial service is online, helpline, one-to-one, physical, like that. And even this data, the presenting the related advocacy event, workshop, training, and everything. If we see the cost, it's around the per unit cost is expanded 11 USD dollars. So just our experience, or just like we completed the 20 years on 6th, so I shared this achievement. So now I am going to the project-related activities. In the project, there are different activities planned, such as the psychosocial care and support. In the psychosocial care and support, we're providing individual counseling, group healing intervention, group counseling, and other psychosocial support activities. Similarly, we have conducting the health and medical support, mental health care and support, livelihood support, social support, and capacity building activities on the trauma-informed care, or care for caregiver, and global rehabilitation standard, and indicator, PSC, and gender equality and social inclusion, and the community-led approach on the mental health and psychosocial support. If we see the learning or like assignment, the trauma-informed care training is the very much impactful or training, where 25 people participating, and through these activities, we learn forecast the transferring the shift in a participant's ability to support trauma survivor effectively, and bridging a gap in knowledge and skill while ensuring balance focus on their well-being as well as the care provider. Similarly, participants left with enhanced the capacity to deliver trauma-informed, culturally and sensitive and sustainable care. If we see the evaluation of the through the pre and post test is changes with the 33% in the knowledge area, so it is the good the achievement of the project. And the similar is if we see the care for caregiver and clinical supervisor, that aims to enhance the psychosocial well-being, forecast interpersonal connection, and promote personal and professional growth. In the CFC session, we conducted the narrative approach activities, just like art and sharing experience like that. And this is the high therapeutic value and team engagement. And similarly, we incorporate the yoga and pranayama related activities to promote the relaxation and mental well-being. The CFC session also the very much interesting, or participants share that their well-being and changes the impact. And similarly, through the clinical supervision, we discuss the betterment of the cases support to discuss on the skills for the psychosocial counselors. So through the CFC session, participants share that session related to trauma related case management, and after that the CFC we conduct the trauma-informed care approach trainings. Through the project activities, we just like 184 individuals received the psychosocial care and support through the 1,285 session. It's related to individual counseling, and 7 days, 7 sessions structure group healing intervention and other psychosocial support activities. Similarly, 45 individuals received the psychiatric consultation and providing the psychotropic medication. And 16 individuals received the health care treatment, just like laboratory support or other treatment support for the medical health. And the 40 individuals received the livelihood-related support. Through these activities, individual or people reduce the traumatic symptom and improve the function self-care practices, and they were able to increase social connection, leadership skill, and access to services in their respective community or healthcare systems. And likewise, the some of the survivor take the leadership position also. They empower. Some are engaged in the last year election also, in the local level election, municipality level election. This is the one of the achievement. And through the livelihood, they can support the continuing education of their children, and through the program, enhancing the awareness and trauma-informed approach, as like the suicide prevention, like that. So these are the main achievement of the program. And if we see the just like if we go to the next step of the project design and extension, it's need to be covered to design holistic support program. For example, not only the psychosocial, it's important the psychosocial is one of the important component within the psychosocial, different activities like individual counseling or psychotherapy and group intervention and like that, and other support, just like physical health or livelihood support is the important thing, health and legal support and physiotherapy, like that. Is need to be designed the holistic service for the such kind of the survivor. Likewise, such kind of the cases, trauma-related cases, is needed to long-term support, not a 2 month, 3 month, or like that 1 year. So it's needed to long-term. Even some survivor we have, they are receiving service more than 20 years. Started to TPO this continues. Some of the survivors taking the services continuously. So if we planning or designing the program for the trauma related cases, is the needed to long-term support. And if we design the program, trauma-informed care approaches or principle into the organization program, it is the necessary. Similarly, the follow-up and support or managing the significantly follow-up. Follow-up means significantly follow-up and monitoring to enhancing the skill and emotional support. Even the staff is also the necessary. Also, staff training, for example, trauma-informed care approach and other issues, and even the refresher training also the needed for the staffs. And always we can focus on the culturally sensitive service delivery model. And now I like to emphasize the livelihood intervention. Through this project, we are focusing the livelihood. With the psychosocial and mental health support, it is very impactful. Many of the cases, even they empower very much, just like they can manage the education, even the day-to-day life. And so livelihood support is the one of the major component if we design the program for the next steps. Thank you. This is my very short presentation. Thank you for the attention. I would like to thank all of you. And I am happy to respond if you have any question, please. Thank you. Rita? This is...
Hello, Beth, are you there?
Maybe she has the problem. I think,
Yeah.
yeah, I think
Great.
we can continue with the Jiyan organization
Yes,
now.
please.
Thank you, Elçin. I immediately started sharing my screen.
Beautiful.
Yeah.
Go for it.
Due to
Thank
the
you.
time, yeah.
Yeah, due to time. Thank
Okay.
you.
Yeah. Welcome. Good afternoon, everyone. And I'm happy to be here and thank you for you all to participate in this important webinar. And before starting, I would like to deeply appreciate the support from IRCT and for all their efforts and support for making our holistic approach to support the survivor of torture, war, and all other human rights violations in Iraq and Syria, because we are active in these two countries as Jiyan Foundation. Thanks again. So yeah, I forget. This is Chenar. I'm working for Jiyan Foundation, and I am in charge as a head of program for trauma care and health. And nice to see you all here. Starting with the name of our organization, Jiyan is a Kurdish word, means life. It's similar to Tree of Life. We are life. We started with our foundation, founded in 2005, first as a name under name of Kirkuk Center for Rehabilitation Victim of Torture. Then we expanded our work, our programs, and even the scope of the NGO has been expanded. So we changed the name from the Rehabilitation Center to Jiyan Foundation for Human Rights. Oh, I cannot change the slide. It's there. 1 minute. Don't know why. Do you see my full screen? Yes, now. So mainly Jiyan Foundation, we are providing our services. Yes, the name is Human Rights NGO, but still the trauma care and health is our main program and the main part of our CV and profile. And under this program, we provide a semi-holistic approaches because we are providing a psychiatric service, specialized in mental health, psychosocial support and well-being, physiotherapist, medical services, and all together. And plus, we also provide legal consultation, and in some project, we provide legal representation for the former detainees and also survivor of torture. But it depends on the project and the indicators of the project. And also we have a democracy and civil society. Under this program, we are trying to make peace building activities and projects. And we have a youth network and also dialogue programs and also children and human rights education sessions for the kids at school. And right and justice, we do a lot of advocacy and for victim of tortures and wars and all other kind of human violation. And last and not least, capacity building program. This capacity building program is for us, our own team. We train just like other partners and colleagues. We still, so far, we did a lot of long and short-term trainings related to the methods, approaches, therapeutic method and approaches to rehabilitate the survivor of torture and trauma. And our approach is based trauma-informed approaches, and also we are using the client-centered approach in our projects. Our locations in Syria, Iraq, and we also have a small administrative office in Berlin as well, in Germany. This is one of our psychiatrists dealing with the children and also the mother of them. Okay. We talked about this. I will try to, as much as possible, to make it short due to the time. Okay. So this picture is one of our facility. We name it Healing Garden. Healing Garden. In this Healing Garden, we are using agricultural animal assistant for healing and rehabilitation, specifically for the children. With the children, adults also, but mostly with the children. It's a very unique and new approach in the region, even I can say maybe, but in the country, definitely. It's a very unique and only approaches which exist with our organization. So coming to our project currently, out of even IRCT support, we are currently having 3 main big project, which mainly all of them supported by German entities. One of them, I-10, is supported and the donor is Foreign Ministry of German government. And it's for mental reconstruction after the war in northern Iraq, mainly in Duhur and Sinjar, Nainawa. And also we have another program for trauma-informed and peace building. We have an integrated project between peace building and MHPSS or rehabilitation program for all the governorate in northern Iraq, Duhur, Erbil, Kirkuk, and Suleymania. And also we have a mental health service for returning migrant and also IDPs in Iraq. It includes all the services that mentioned before. Okay, so Jiyan and IRCT. So far, 3 times IRCT supported Jiyan Foundation with a grant. The first one was in 2022, started in February till September, and the grant was something like 9,000 euro. Key activities in this grant was report on Iraqi implementation of the UN Convention Against Torture, briefing to the committees against torture in Geneva, and also IRCT provided technical expertise and guidance to Jiyan for our advocacy in this grant and project. Again, during the pandemic, IRCT supported Jiyan Foundation with a small grant for procurement and personal protection for our team, because it was a very critical. We had a very critical situation during the pandemic for getting and reaching out to our cases, to our beneficiaries, and all the structure, health structure from the ministry, from the WHO required a lot of equipment, and for that IRCT supported us. And latestly, in 2024, IRCT supported us with a bit bigger grant for one of our big project, which been funded by Missouri originally, but and one of the difficulties or a challenge for NGO like us, and especially as is that nowadays so many international donors put in like a co-funding as a condition for getting a bigger fund, so which is not easy, especially in our context, while the government is not supporting in any way, especially the financial support for NGOs like us for the MHPSS services. And so it's a very big challenge. That's why this grant was, particularly this grant was like a significant support for us to keep our holistic approaches for supporting specifically the survivor of ISIS and Yazidi women and their children as well, because during this project, Elçin mentioned some of the data from this project in the beginning, but we served the Yazidi females in our only inpatient clinic, which we name is Women Clinic, for women and their children, and who they are, all of them are survivor of war. So we used this grant for supporting this project for 2 years. and it was a very important for us and for making this project succeed. So the key activity of this project was creating informational materials like brochure flyers to be distributed in the IDP camps among the Zidian community, and to advertise and motivate also the women to come and to participate in our stabilization program for stabilizing their trauma in our clinic. While the inpatient clinic was, we were providing shelter, food, all the like a lunch, breakfast, dinner, everything was on Jiyan. So and for the women and their children. And also we deliver trauma-informed psychotherapeutic service to survivor at in our clinic. We provided individual and group therapeutic sessions in the women clinic, and also after finishing this inpatient forward and staying forward in the women, after that we continuously provided the therapeutic or rehabilitation service for our client through our location in the northern west of the side of the country in Duhok and Nainawa. The women's they had the opportunity to continue receiving the support, because it's a long process. Rehabilitation for traumatized ones like a survivor of ISIS is not an easy and a quick job for the therapists and for the clinician as well. And also we provided a self-care training for our own staff, plus for other professionals and other NGOs who they had a project for the survivor of ISIS, and especially for the Yazidi women. Yeah, so mainly that was, and I just want to use this opportunity also to briefly highlight some inputs about our current context in the country and in the region also in general. While still Iraq as a country and also Syria as a neighbor country, we still suffering and from the long history of war, conflict, different kind of war, armed conflict, internal ones, civilian ones, and still this kind of conflict had a lot of impact on individuals' well-being, and may lead it to make a lot of mental health conditions among the community, which means there is a huge need and at the same time significant lack of service providers, a lack of the professionals who they could support survivors for reintegration and reprocessing their trauma. That's why I need to highlight this. It's this kind of support. Yes, maybe you see the number because our projects are usually $1 million project, million EU, or maybe sometimes it's 2 million euro. You see the number of 30,000 as a grant. It may seems like a small, but it's very initial still. As I mentioned, due to the co-funding and to deliver all other to support this holistic approaches to keep it in on the trial. And also now, beside that, the government constitutions also has no capacity to support its own people who they are in need for MHPSS help or services. That's why many people left it without support, or even without potential possibility for getting support from professionals and clinicians or psychotherapists. That's why the need is huge, and the support is needed, and still the country in very uncertain situation. Since last Friday, we are region in war between Iran and Israel. All the night, every night, is airstrike or bombardment each other, which we are against this war, because at the end, civilians will pay, and will left a lot of wood and also needs for our rehabilitation project and services in the region and in the country as well. I am done with that. Thank you again for the opportunity. Thank you, you all for being with us today, and thank you, IRCT, of course, again and again for making all this happening.
Thank
Over
you,
to you,
Chenar, for
Berta or Elçin.
Thank you. I'm sorry, I froze for 1 minute, and I think that was the moment where we were changing presentations. I apologize for that. But thank you, Chenar,
It's okay.
for this inspiring overview, and also for showing how, you know, service delivery and advocacy, like with the Coalition for Just Reparations, can go hand in hand as well. But yeah, I noticed the time. As always, we're a bit behind with time, but I will suggest maybe we can take 2 questions. At the same time, we will put on screen, launch the poll on screen that has the 3 questions, the 3 usual questions about your satisfaction about these spaces. So yeah, we can take maybe 2 questions, and the rest I will encourage you to maybe write them in the chat, and I will try to take them bilaterally as a follow-up to this session, to this webinar. So who has his hand up? I cannot see anyone with a hand up. Otherwise, there were a couple of questions in the chat. From Leslie, she was asking, what are some of the monitoring and evaluating tools you use to measure impact, especially now you measure trauma and emotional stability and increased resilience among survivors? Not sure if Leslie is still with us. I'm gonna try to see, because otherwise we can take the...
Yes.
Yes, you're here.
Yes, I'm here. Hi.
Hello, Leslie.
Hello. Hi, Bart. I can hear you.
Yes, we can hear you. I can see, Leslie, that you asked this question at 3:24. So I'm not sure which specific presentation or presenter were you relating the question to.
Thank you so much, Berta. My name is Leslie Rono First. I work for Midriff Human Rights Network. We're based in Nakuru, Kenya, and we work around matters of violence, especially prevention of violence for gender-based violence survivors. So my question was to the first presenter who provided a summary or an overview of the entire partnership and the projects that are implemented in the different countries. So the statistics were quite impressive, considering the impact that the IRCT program has been able to realize in the different countries. So from an M&E perspective, what are some of the tools that we use? Because it's a very, very, very delicate issue when we deal with mental health, particularly as researchers and M&E practitioners. So I'd like just to pose if any M&E tools that you use to assess impact, especially at that level of torture and of trauma and emotional stability, as well as increased resilience for the survivors. Thank you.
Okay, maybe I can hear my voices. I don't know why, but
Yeah, I think it's Leslie. I will mute her.
okay. I just can say that there are many different evaluation methodology IRCT member organization which receive this grant using in the field. And maybe, I don't know, maybe among our presenters, they want to share their evaluation methodology, because or we can maybe share based on the reports. It's some organizations are doing pre-post interviews with survivors. Some are using Hopkins methods. Some are using the World or medical organizations scales. It's very, I mean, there are a variety of evaluation methods. But maybe, I don't know, Jiyan organization or Ian organization, they can share their specific methodology, if I understood the question correctly.
Anyone? No, you're also shy.
Well, I can share a little bit very shortly, but within this project, our revelation is, like Elçin said, during the interview process, before the treatment, and during the treatment, after 2 or 3 months, and at the end of the treatment. But usually at the end of the treatment is, I mean, many of our beneficiaries, when we speak about asylum seekers, they leave the country, but we are trying to evaluate our services and their emotional state with the interview, because we have at this moment different type of people that we are working with, and we cannot share the unique way of assessment, I mean, and evaluation, because we don't, for example, have psychological questionnaires in all possible languages that we need, and it's not adapted to all cultures. So we usually use this, if I say Western-oriented questionnaires, and it's not appropriate for some of our beneficiaries. So we are trying to adapt to circumstances and to our beneficiaries at the moment. So within this project, we used like interview, and where we have a couple of questions when we ask our beneficiaries after the treatment and during the treatment about their satisfaction.
Thank you, Bojana. I hope that was useful, Leslie. And in any event, if you feel like you would like to expand more on the questions, feel free, Leslie, to drop your email on the chat so I can connect you both, or we can take it forward. We set another question, although I would kindly ask if it's a short question. Otherwise, I can see Eugenia and Mike, you have the hand up. So maybe we'll take you last, and then we'll close the meeting here because we're already 9 minutes delayed. 7.
Yes, Betha, thank you so much. So we saw a question on the asking whether we use Singing to the Lions with Gukura Hundi survivors. And I wanted to comment that, I wanted to confirm that of the groups in the southern region were from areas that were affected by Gukura Hundi. Thank you, and over.
Good. Sorry, I noticed I was muted. Okay, I think we'll have to close it here. Again, thank you everyone for prioritizing this meeting today. And I hope you're going to have a good summer break for the ones who have summer break now. And again, we'll be wrapping up the webinar sessions with the new program in August. I'll make sure I share the program during next week. And a reminder that if you do have suggestions of topics that you would like to discuss in these spaces, or different ways of having these spaces hosted, please do email them to me. We can have a conversation about that. And yeah, I think that's all. I want to thank the speakers again for their time. Bojana, Chenar, Mike, Eugenia, and Pitambar, and Elçin, of course. And
thank you.
Yeah, I think also the interpreters here. Sorry, someone was calling. Okay, we'll leave it here.
Thank you.
Have fun, everyone.
Thank you, everyone. Take care.
Bye-bye.
Thank you.
Bye-bye.
All right, thank you.